Batten disease, a rare and devastating neurological disorder. Batten disease, also known as neuronal ceroid lipofuscinoses (NCLs), is a group of rare, inherited disorders that affect the central nervous system. These disorders impact the body's ability to break down certain substances within cells called lipids, fats. When these lipids accumulate in the brain. Classification of Batten disease. Batten disease is classified based on the age of symptom onset, including 1. Infantile NCL begins between 6 months and 2 years of age. Seizures. Failure to thrive. Vision loss. Abnormally small head size, microcephaly. Muscle stiffness, spasticity. 1. Infantile NCL seizures. Failure to thrive. Vision loss. Abnormally small head size, microcephaly. Muscle stiffness, spasticity. The disease progresses rapidly and is often fatal before the age of 5. 2. Congenital NCL present at birth. Early onset seizures. Failure to develop. Vision impairment. Early onset seizures. Failure to develop. 2. Congenital NCL vision impairment. The disease progresses very quickly, often leading to death within a few months. 3. Late infantile NCL begins between 2 and 4 years of age. Seizures. Failure to thrive. Vision loss. Motor problems. Seizures. 3. Late infantile NCL failure to thrive. Vision loss. Motor problems. The disease progresses more slowly than the infantile form, but is typically fatal between 8 and 12 years of age. 4. Juvenile NCL begins between 5 and 10 years of age. Seizures. Vision loss. Motor problems. Cognitive decline. Seizures. 4. Juvenile NCL vision loss. Motor problems. Cognitive decline. The disease progresses more slowly than the infantile and late infantile forms, but eventually leads to significant disability. 5. Adult NCL begins before the age of 40. Seizures. Cognitive decline. Vision problems, not blindness. Psychiatric disturbances. Seizures. 5. Adult NCL cognitive decline. Vision problems, not blindness. Psychiatric disturbances. The disease progresses slowly, and the life expectancy of affected individuals can vary. 3. Causes of Batten disease. Batten disease is caused by a mutation in a gene, inherited in an autosomal recessive pattern. This means that a person must inherit 2 copies of the mutated gene, one from each parent, to develop the disease. 4. Disease mechanism. 4. Disease mechanism. Batten disease affects cells called lysosomes. Lysosomes are like the recycling bins of cells, responsible for breaking down waste products and unwanted substances within the cell. When the genes responsible for lysosomal function are mutated, lysosomes malfunction, leading to the accumulation of lipids in the brain and causing brain damage. 5. Diagnosis of Batten disease. Diagnosis of Batten disease is based on clinical symptoms, brain imaging studies, and genetic testing. 6. Treatment of Batten disease. Currently, there is no cure for Batten disease. Treatment focuses primarily on managing symptoms and improving the quality of life of affected individuals. 7. Prevention of Batten disease. Since Batten disease is genetic, prevention primarily involves genetic counseling for families at risk. Note: Batten disease is a rare and serious disorder. Early diagnosis and treatment are crucial for improving survival and quality of life for affected individuals. Families with a history of Batten disease should consider genetic counseling to assess risk and explore options for prevention.